Thank you very much, Mr. Speaker. And it's a pleasure for myself to join into a debate talking about something that is very important to the constituents of Regina, to people in southwest Saskatchewan, and that's the ER emergency room in Pasqua. And Mr. Speaker, I think I speak for many people that say I want to thank the Minister of Health, the hardworking team in the Regina-Qu'Appelle Health Region, the ER doctors, everyone that was involved to come into an agreement to ensure that the emergency room at the Pasqua Hospital will be open for the immediate future. Mr. Speaker, I think it's interesting that they brought this motion forward, and it was brought forward by the member from Regina Lakeview. I don't know what they promised him to make him stand up for 15 minutes and talk about health care when he did an absolute terrible job as the Minister of Health when he was the Minister, Mr. Speaker. And I think for him to stand there and talk about all the things that they were going to do, we're going to do this, we're going to do that, we just didn't have the money. Mr. Speaker, it really flies in the face of them then saying, oh, we left so much money in the bank account, why didn't you do this? It's because we had economic growth. Mr. Speaker, especially when it comes to ERs in particular, and I like to quote from the Star Phoenix, Mr. Speaker, when the ER in Royal University was in crisis, the NDP passed off the responsibility to the health regions, and I quote, Mr. Speaker, Saskatchewan Health Minister John Nielsen told reporters on Thursday that the region was responsible for settling the disputes with the emergency room doctors and he would not get involved. Mr. Speaker, I understand that they're a little upset today, Mr. Speaker, and I think there's only 9 people in Saskatchewan that are upset that the Pasqua ER is open. Because, Mr. Speaker, they stand in their spots right there and they talk about how important the ER is, how important the Pasqua ER is to people in Saskatchewan and people in southwest Saskatchewan. And then they stand up and give speeches and talk about how mad they are that Pasqua ER room is open. So I think there could be a bit of contrition. You know, they had to have their motion in 3 days early, and things change, Mr. Speaker. It's kind of a fast-paced world in politics, and things are changing for the better. So why couldn't they just stand up and say, you know what, we don't do it often, but congratulations to a government that got the Pasqua emergency room open, and we thank you guys for doing that. I don't think that would have been too hard for the member from Lakeview or the member from Rosemont to do. It's a fantastic thing that we have care for people in Regina and southwest Saskatchewan, and I think I know it's not very common where the opposition say thank you, but this could have been one of those cases. Mr. Speaker, I know that we're gonna have conversations back and forth, and the member from Rosemont hasn't talked enough, so he's still trying to talk from his seat. But I think we need to hear of the records of our government and when they were in government, because, Mr. Speaker, and I'm pretty comfortable with the member from Rosemont and Lakeview want to have an election based on health care. I'll have that fight every day, Mr. Speaker, because I'll put our record against their record any day of the week. And, Mr. Speaker, and I think they get angry when we want to talk about their record. We want to talk about them closing 52 hospitals across Saskatchewan when they are in government. And I, for sure, when I'm in Regina, want to talk about the closure of the Plains Hospital, Mr. Speaker, because when I was knocking on doors, and this just isn't from me, Mr. Speaker, when I was knocking on doors, 1 out of 5 doors go, you know what was a really bad idea? Closing that Plains Hospital in 1999. And, Mr. Speaker, that's coming from constituents of Regina Walsh Acres. Wow. That's coming from people that I think the NDP just thought people were going to forget about the Plains Hospital. And it's SIAS now. I think it always was SIAS, actually. That's not the case, Mr. Speaker. And they want to talk about us not having the job done in health care. And I think that's something where we're going to have to correct the record right now, Mr. Speaker, and I think records are very important. And the member opposite talked about not consulting nurses, not consulting healthcare professionals, which last night I had a fantastic talk with a lot of people in the health sciences reception, which was fantastic to talk to frontline workers and see how they feel. But here's some interesting quotes from Sun, Mr. Speaker, and this isn't a quote from 1986. This is from April 2006. It's frustrating to see a profession you love so much and the communities you care for be disrespected by your own government. That's, Mr. Speaker, from Rosalie Longmore on nursing shortages under the NDP. There's no light at the end of the tunnel unless it's a train. These staffing levels are dangerous. Mr. Speaker, that's their record. There's no light at the end of the tunnel unless it's a train. And they're going to come and stand in their spot in this legislature and say, we have done nothing for nurses. Mr. Speaker, we've had 1,000 more nurses start working in Saskatchewan since 2007. And I think that speaks to our commitment, the member from Regina Pell Valley who went on the nurse recruitment trip, our commitment to bringing nurses and improving health care for people all over our province. There's a couple... Rosalie Longmore, President of Sun, said in September 2007, September 26, staggering workloads and excessive overtime are driving our nurses away. And obviously, Mr. Speaker, we saw that in the NDP's nurse recruitment records, Mr. Speaker. Nurses were leaving the province in droves under the then NDP government. Mr. Speaker, and I think it's very interesting that they're quiet over there now. They don't want to talk about their record, and I think we saw some very angry people speaking about Pasqua ER being open, Mr. Speaker, and there's only 9 people that are mad about the Pasqua ER being open today. Mr. Speaker, I want to talk about a few of the things that we've done in emergency care, because the member from Rosemont talked about emergency care and when seconds count. And I agree with him on that. When seconds count, emergency care should be there. And that's why we brought STARS to Saskatchewan, Mr. Speaker. Probably one of the best emergency care initiatives brought forward in this province, Mr. Speaker. That's when seconds do count. And they looked at bringing in air helicopters a couple of times, and they said it couldn't be done because they didn't need it. And we thought the people of Saskatchewan deserved to have the best medical services available in a timely manner. And I think STARS is one of the great initiatives brought forward by a government that cares about the health care of their people to make sure that they have timely access to emergency and critical care. Mr. Speaker, I think we show every year during budget time our investment and how much we care about health care in our province. Over the last 6 years, we've invested $1.1 billion in health capital, Mr. Speaker, and I think that's pretty important. And when we want to talk about hospitals, I think we want to do a compare and contrast between our record and NDP, Mr. Speaker. We build hospitals, they close hospitals. We recruit nurses, they lose nurses. We recruit doctors, they lose doctors. In a nutshell, Mr. Speaker, that's pretty much how our record has played out in the last 5-6 years. We have STARS, they don't, Mr. Speaker. And also, Mr. Speaker, we are committed to building a couple more hospitals. My friend from Moose Jaw North talked about the Moose Jaw Hospital coming online, Mr. Speaker. That's very exciting for South Saskatchewan patients. My friend from North Battleford, we're looking at the new psychiatric hospital in North Battleford. That's approximately $110 million. The new Children's Hospital in Saskatoon, Mr. Speaker, which I think was a wonderful initiative brought forth by this government. My friend from Saskatoon Northwest enjoys that. Mr. Speaker, we're committed to a new Plains Surgical Outpatient Centre in Regina. So speaking about the Plains, Mr. Speaker, I think it would be something that I'd be remiss if I didn't talk about a couple more minutes, Mr. Speaker. And they want to talk about Southern Saskatchewan's need for emergency care. Well, that was one of the reasons the Plains Hospital was built, Mr. Speaker. Great access coming in from Estevan, from Weyburn, Mr. Speaker. That was a jewel of a hospital. There was first-class care coming in, Mr. Speaker, and I think that they don't realize how much that hurt Southern Saskatchewan, rural Saskatchewan. They didn't care. That's right, Mr. Speaker. I think almost they cared more about the Plains Hotel shutting down than the Plains Hospital, Mr. Speaker. And I think when it comes to it, Mr. Speaker, that they closed the Plains Hospital strictly based on politics. They wanted to keep a hospital in downtown Regina and they wanted to keep a hospital at the Pasqua. Politics played a huge role in that decision. I don't think so much good public policy did, Mr. Speaker. In door knocking in 2011, as I said, the constituent said, you know what's bad public policy? Closing the Plains Hospital. And I would wager that I'm going to have some more comments on the Plains Hospital in the 2016 election, Mr. Speaker. And I think people don't forget bad decisions. And I think that's why the member from Lakeview and the member from Rosemont don't enjoy talking about their record, because it's chock full of really bad decisions, Mr. Speaker. Also, Mr. Speaker, there's a couple more numbers I'd like to throw out before my time's done, and that's the opposition's record when it comes to doctor and nurse retention in our country when they were in government, Mr. Speaker. Between 2001 and 2006, the NDP's last 5 full years in the province, we lost 1,160 total healthcare workers, 455 RNs and RPNs, 117 physicians, 155 pharmacists, and 95 physiotherapists. Mr. Speaker, that's a record of decline. That's a record of stagnation, Mr. Speaker, and I'm proud to be on the side of a government that has a record of growth, a record of retention, and a record of healthcare being moved forward. And I'm happy to say that the Pasqua ER is open for business.